Hi, welcome back, Mr. Krishnadas. I'm Athira, I'm going to be your student physical therapist. So today what we're going to do is we're going to work on some interventions for your diagnosis of chronic bronchitis. So what we're going to do is some postural drainage, segmental breathing, as well as some vibration. So we're going to begin with postural drainage. So what I'm going to have you do is I'm going to have you come and lay on this bed on your left-hand side. Okay, and then just scoot over a little, perfect. And then I'm gonna have you place your left arm behind your body, and then your right arm is gonna hug this pillow so that you're turned 45 degrees. And then you keep your left leg straight and your right leg can be bent at your knee. There we go, perfect. So now what this is doing is it's draining the posterior right upper lobe segment, which this is good for chronic bronchitis patients because they have mucus in their lungs. And so what this is doing is it's draining the mucus out of that segment, and it'll be better to have like a productive cough, essentially. Now, typically we would leave you in this position for 5 to 10 minutes, but we're not going to do that today. If we were draining multiple segments, so if we were doing more than one postural drainage position, we would make sure that we don't exceed 35 to 40 minutes. Okay, and then I'm going to have you come and sit over here. So next what we're going to do is we're going to do some segmental breathing. I'm going to ask you to kind of just spread your feet apart and then lean on your left knee. Perfect. Okay, so what I'm going to do on this one is I'm going to place my hand on the same segment, so the posterior right upper lobe, and so the back. What I'm going to ask you to do is just breathe into my hand. Just focus on breathing into my hand. Okay, good. Now what this does is it increases airflow to that specific segment, and this can be beneficial for people with consolidation, which just means that you have mucus in your lungs, which is a symptom of chronic bronchitis, but it can also help with people who have pneumonia or atelectasis. For the last one, we're going to do some vibration. So if I can have you just face that corner over there. Perfect. And what I'm going to do is I'm going to place my hand on the back as well as the front this time. And then I'm just going to ask you to take, just breathe. There we go. Okay, so what I was doing was whenever you breathed in, I relaxed, but on the exhalation, I would move my hands, and so that's vibrating. And what that's doing is that's just manually dislodging any mucus that you have in the lungs to make it better for a productive cough. Typically we would do this for 5 minutes, but we're not going to do that today. And so that's all we have for today, and so we'll see you next time.